Today I chaired a session on healthcare disparities in countries around the world. So I represented the United States. There was a speaker representing Europe and one representing Asia. And I think that enviably people in Europe have access. So that's not their biggest issue. They have more concerns around adherence and having enough providers to do all the education and care that patients need. When talking about Asia, there's the biggest problem because they frankly have the most patients with diabetes, and for many individuals there is not access to care, medications, or what they need. And there's also a lot of issues around food and people developing diabetes earlier and having a lot of gestational diabetes, which then frames the metabolic abnormalities in the offspring that increases their risk of subsequent diabetes. But I got to talk about issues in the United States. And my real message is about advocacy, because I've been working my whole career in the County of Los Angeles. We're the most populous county in the United States, and I've just been there. And I've been working with the Department of Health Services for Los Angeles County, and they've changed leaderships over time, but we have a little diabetes work group, and this consists of several endocrinologists and several people who are primary care providers, as well as a number of administrators. And we've just plowed ahead. We meet every other week and have done so for years and years to make guidelines and strategies for the management of diabetes across our population. And the very first thing we did was to create a unified formulary, because if you lived in one part of LA County in a safety net system, you'd get one kind of formulary. And then if you were in another part of town, say the southern part of the county, you'd get another formulary. And we really wanted to unify the formulary, but not only unify it, create a formulary that was based on quality, not just cost. So over time, we've been able to get SGLT2 inhibitors on the formulary, as well as GLP-1 receptor agonists, and basically any kind of insulin you want for patients with type 1 diabetes. In addition to that, we have guidelines and algorithms that we've created for primary care providers so they can figure out how to use the newer medications. And then we have e-consults and a number of different ways to reach the endocrinologist so we can help further advise care. Another big thing that we've done is on a statewide level, I, along with a number of really involved individuals, have lobbied the state government to approve CGM for people who have Medi-Cal insurance, which is the same as Medicaid in other states. And we've been successful. There were setbacks along the way, but we've succeeded, and now basically anyone in the state of California with type 1 diabetes can get a continuous glucose monitor. And to me that's huge, because in LA County, where I treat my patients, I used to have trouble getting them CGM. It used to be that this person could get it because they had this kind of insurance, they had Medi-Cal HMO, and this one didn't, and now everybody can have CGM. So in my patient clinic, where everyone has type 1 diabetes, pretty much everyone comes in on CGM, and because of that, I used to be able to get pumps, but now I can get pumps that talk to the CGM, and we have automated insulin delivery systems available for appropriate patients. So my message is that patients need a champion. They need us to really go and work to get care systems to provide the tools we need, the medications we need, the devices we need, the educators we need, so they can help our patients with diabetes achieve their goals. And I must say that I'm an optimist in that I believe it's possible. And I know we've done a lot of good things in Los Angeles County and in the state of California, and I think we need to do better still. And so I'm looking at ways of getting involved nationally to try to make an even bigger difference in terms of the health and quality of life for our patients with diabetes. Thank you.